For too long, Australian law didn't just fail survivors, it forced them into silence. Nina Fennell is a Walkley Award-winning journalist and a survivor who helped overturn damaging gag laws in the Australian justice system. She was the driving force behind the campaign that allowed women to finally speak their own names. Her work doesn't just tell stories, it drives change. Hi, I'm Gemma Barth, host of True Crime Conversations. And this very special two-part episode isn't just about the justice system. It's about what happens when women are finally heard. A raw, honest look at the power of a single voice, how silence is shaped, and how women push through it. Hear my conversation with Nina Fennell on True Crime Conversations. Search True Crime Conversations wherever you get your podcasts, or click the link in the show notes to hear Nina's story now.
Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, I'm Brigid Maloney.
And I'm obstetrician Dr. Patrick Maloney.
And today we are going to be talking about a listener question that is common that people ask this question, but it speaks to when we go and have a test done and we hear words said in that test, or we read a report and we just really start to worry. So I'm going to read the listener question first and then we'll go on for it. Hi guys, just found out I'm pregnant. I'm about 6 weeks with my very first. I was on the pill for 14 years, then fell pregnant in the first month after going off it. ! Loving the podcast so far. I've just found out that I have a cyst on my ovary that is 4 centimetres. I've never had cysts before as far as I know. From what I understand, this is very normal in early pregnancy and will likely resolve itself, but I can't find too much information about it and the doctors haven't given me much information. Could you please discuss this?
Fine.
Good. All right. So, let's start really simply. Someone is 6 weeks pregnant and they've been told that they have a 4 centimetre ovarian cyst. Should they be worried?
Yeah, usually not. So we don't have any details, unfortunately, on what the cyst looks like. But it's probably just a corpus luteal cyst, which is a perfectly normal thing to find on a 6-week ultrasound. So when the egg comes out of the ovary, the bit on the surface of the ovary that the egg pops out of forms a structure on the edge of the ovary called a corpus luteum, and its job is to pump out a bunch of progesterone in the second half of the cycle and help the pregnancy get up and underway. And that's the source of progesterone in the early part of the pregnancy until the placental structures kick in. So that's a perfectly normal and necessary thing to be there. And you can usually zoom in on one ovary or the other on a 6-week scan and see which one's ovulated because there'll be a corpus luteum there. And the structure, it's quite normal for corpus luteum to bleed when the egg comes out, and sometimes it forms a little thing called a hemorrhagic cyst, which is a little bit of blood clot sitting on the corpus luteum, and that's a normal thing as well. One of the reasons why ovulation is mildly painful in some people. And so that could be all that is there. And a good ultrasound report will say what it is. If they think it's corpus luteum, they should say so, because that's perfectly normal. Other times the ovary might have something called a simple cyst on it, which is like a sac full of water. And what that sometimes is just another follicle that was forming and then didn't ovulate. A different one did. And that's what that one's left there. Because once the ovulation's happened, there's some signaling within the ovaries not to bother ovulating any more eggs. Otherwise we'd have multiple pregnancies all the time. And so that could just be an arrested follicle at 4 centimetres, which is another thing that happens all the time, is normal and just resolves by itself.
So in this case, it is possibly just the egg that has erupted?
Yeah.
Or could it be the follicle?
Another sac with another egg in it, yeah.
Yeah. And I'm curious about multiple pregnancies. So what do you see? What does the ovary look like do you see two corpus luteums, or you?
Yeah, well, potentially. So if you saw one on each side, that might be evidence that the woman's ovulated twice, which would be the sort of two-egg fraternal twins. Of course, the other one's the ovulation's just once, and then that fertilised egg splits apart.
So she talks about her cyst being 4 centimetres. What's the normal range at this stage of pregnancy?
The harmless cysts are typically about that size or smaller. And we get interested in cysts that are more than about 5 centimetres, 6 centimetres, or painful, or causing the ovary to twist, or having an abnormal appearance on ultrasound. So some cysts look very different and are very different diagnoses. Okay.
So what do those cysts look like on ultrasound then?
Well, there's a whole bunch of different types, and occasionally these are seen on first trimester scanning as well. And some of them are more significant than a simple little one that looks like a corpus luteum, or a simple little one that looks like a simple follicular cyst. And the other ones that we would commonly see would be something called a dermoid, which is an ovarian cyst full of stem cells that have been in that woman's ovary for many, many years. And these are the freaky ones that are capable of turning into any type of tissue type. So typically the ovarian cyst will have structures that really belong elsewhere in the body, and they're formed inside the ovary from stem cells. And those would, typically there might be bone, cartilage, hair, fat, lung tissue, brain tissue, and those are sort of a strange-looking thing, not cancerous, but a strange-looking thing. And sometimes some of them will have a dermoid in the ovary, or even both ovaries, and sometimes of a decent size. But because they haven't really affected ovarian function, nobody knew they were there. And it wasn't until the woman had a first trimester ultrasound that the dermoid was discovered.
And so that dermoid, I don't want to go down that path because I think it's pretty rare, isn't it, dermoids?
No, they're common.
Oh.
Yeah.
Wow.
Yeah, they're common.
And so they are just sitting there, and by chance that might be a discovery on ultrasound.
Yeah, because you hadn't had an ultrasound for any other reason. They weren't causing you pain. They weren't doing anything. Your fertility was normal.
Right, I'm going down that track now. So if during a pregnancy a dermoid cyst is seen, is anything done with it then? Typically
not. What you need in that situation is a high quality ultrasound to make sure that it has a typical appearance of a typical dermoid. And that can be pretty easily done. We would only get interested in that dermoid if it was very large and potentially obstructing the baby's way out, or if it was, or if it had potentially malignant features, or if it caused an ovarian torsion. So if it made the ovary lopsided and caused the ovary to twist around on its stalk and cut off its own blood supply.
It's Monday morning and your mind is already racing.
And you're replaying an awkward conversation you had during the week. Your inbox is full, your patience is gone, and life just feels like a lot.
I'm Ashani Dante, and alongside with clinical psychologist Dr. Anastasia Horonis, we're here to help you unpack the messy, honest stuff that keeps you up at night.
And this is But Are You Happy? The Mamma Mia podcast where we skip the fluff and dive into the real talk you actually need.
This is the mental health podcast you and all your friends need. Listen to But Are You Happy Now, wherever you get your podcasts.
Let's talk about ovarian torsion because can a cyst cause ovarian torsion apart from this dermoid situation?
Yeah, typically it's only a cyst that will cause it. So the ovary, a normal ovary is incredibly unlikely to get a torsion because the stalk of the ovary inserts into the middle, and there's no reason why the ovary would spin around unless it was lopsided. And the lopsidedness is because of a cyst.
Oh my God, I've got in my mind a goldfish. A goldfish that ends up having like a blown up belly because of some reason goldfish do this.
Yep.
And then the goldfish just goes
spins around.
Spins around.
Yeah, I guess that's what it's like. So those are not, that's something that presents with pain. And then you have an ultrasound, you can see an ovary with a cyst on it. There's no flow inside it. And occasionally a torted ovarian cyst is a sort of surgical emergency that could happen during pregnancy. And one of the rare reasons why we might need to operate in pregnancy.
And so, there's so much new pain that a woman experiences during the early phase of pregnancy.
Yeah.
Can you describe what the usual symptoms that people say to you they're feeling when they've got an ovarian torsion?
Ovarian torsion pain is very severe. It's associated with nausea and vomiting. It's relentless, and not easily missed. Occasionally it comes and goes, which is thought to be a process of torsion and detorsion as it twists and then untwists and twists and then untwists. But it's mostly the severity that brings it to people's attention.
Yeah. So going back to a normal sort of common cyst in this early stage of pregnancy, so she was had an ultrasound at 6 weeks. If she went on and had another ultrasound, what would they see normally?
Well, you'd expect resolution of the simple ones and resolution of a corpus luteum. And the dermoids and so forth would still be there. And then if the dermoid is nice and stable, it's not growing, it's not torting, then it can just be left there. And that can be reassessed postpartum and excised laparoscopically at a later date if that's thought to be the plan. Very rarely an ovarian cyst happens in pregnancy, is discovered in pregnancy that has features on ultrasound suggestive of an early malignancy. So like a stage 1 ovarian cancer. And that's just something that can happen, but is exceedingly unlikely because hardly anyone gets ovarian cancer in the pregnancy age group anyway. But again, one of the rare reasons why we might not want to operate in pregnancy would be if an ovarian malignancy was suspected.
Wow.
So that would not only be an ovarian cyst that looked very dodgy, but also blood tests that would be abnormal.
Again, going back to the normal cyst, if someone has a cyst that, they hear the sonographer or someone saying, oh, there's a bit of a cyst there, or they read the report themselves or whatever, does their GP or obstetrician then say you need to be re-scanned at a certain stage, or we just expect it to resolve?
No, we would typically re-scan because a large cyst, like if it's one of those small first trimester ones, just expect it to resolve, then they're entirely normal. But a large cyst would definitely want to be re-scanned because there is a phenomenon where a very large cyst could theoretically obstruct labour. The ovaries sit lower. If we think of the sort of secondary school diagram of the female reproductive system, it looks like the ovaries are sort of sitting out to the sides of the uterus. But when the uterus grows to a full term pregnancy, they're not sitting up near the top. They're sitting much further down towards the cervix, and a big cyst at that point could theoretically obstruct the baby on the way out.
Yes, because you only have to dilate 10 centimetres to push a baby out. And if you've got a cyst that's 10 centimetres, 15 centimetres, like that would be significant, wouldn't it?
Potentially, yeah. So in that situation, which comes up from time to time, a decision needs to be made about whether we would go one of 3 ways. You can have surgery during pregnancy to take a cyst out. That has significant pros and cons and ideally is best avoided. You could have a planned caesarean section if you thought the cyst was going to obstruct the baby's way out, but that is a shame if somebody doesn't want the caesarean section. And lastly, you could do a trial of labour and just see how the baby goes, getting past a large cyst.
I think it's hilarious that you talk about that secondary school picture of the female's anatomy, and it does. The uterus looks like it's got little sort of branches but the other day when you were describing a uterus only being the size of an apricot, a normal uterus before pregnancy, like that isn't the picture that I have in my brain.
No, it's not. It's quite different, really.
Yeah.
A number of things are different.
Yeah.
I think the most misleading thing about the diagrams is that they show a sort of a diagrammatical representation where the tubes are stretched out and the ovaries are right out to the side. And that leads women often to think that if they've got pelvic pain that's very lateral, right out near their hip bones, that's ovarian pain. But in fact, the ovaries are very, very close to the middle of your body. And you'd have to have quite a big cyst on an ovary for it to reach out towards the pelvic sidewall like that.
It is funny though. So people do complain of pain during ovulation, which is very side.
Yes,
right,
you can often tell the difference one side or the other. Yeah, but that doesn't mean that the ovary is located right out on the edge of your body.
Yeah. We had a student up the other day and even she was in surgery with you and went, oh my God, I can't believe how small the uterus is. So yeah, it's fascinating. Like we get an understanding of our body when we listen to podcasts like this, I hope.
I hope so.
Well, I certainly have over the years.
I'm Kate Langbrook and I host No Filter. Celeste Barber.
Hi.
Welcome to No Filter.
It's nice to be here.
Yeah, today we're diving into the world of G-Flip.
And your voice has always been such a calming, warm energy. So that's why I tear up, because you're like always growing up with you around. So thank you.
Sally Hepworth, what a absolute jewel you are in the crown of artists.
Oh, thank you. This has been lovely.
Today, we're talking to Rosie O'Donnell.
I just want to tell you, this is one of the best interviews I've ever had.
If you love conversations that go deep and stories that stay with you, listen to No Filter. New episodes of No Filter drop every Monday, wherever you get your podcasts.
Now, I know that this podcast isn't about cysts outside of the pregnancy, but can you very briefly mention some reasons why people might have cysts outside of pregnancy?
That's a whole bunch of podcasts in itself. So ovarian cysts are a really common thing that we see, ranging from simple ones, little bumps on the ovary, right up to cancerous ones. Huge topic, and an important part of gynecological practice. But today we've been sort of concentrating on the ones that might affect a pregnancy. Yeah. The other thing that I've seen from time to time in pregnancy are other types of pelvic cysts in women, not ovarian cysts, but there's two that we commonly see. One's something called a Bartholin's cyst, which is an obstructed gland near the vaginal opening. And the Bartholin's gland sits just inside the vaginal opening, and one of its jobs is to make vaginal mucus and lubrication for intercourse. And it's got a narrow duct that gets blocked. And you can get a Bartholin's cyst in pregnancy and present with a big swollen, very, very sore cyst right at the vaginal opening. And I've had a few of those that needed operations even in pregnancy. And they're managed much the same way as you would if a woman wasn't pregnant. If it's big and sore, it needs to be drained.
Under general anaesthetic?
Yeah, under general anaesthetic. There's another thing that's commonly diagnosed as a cyst, and it isn't really, and that's something called a Nabothian follicle, which is a cyst in the cervix. And these aren't really, they're not quite accurately called a cyst. What happens is the cervix has got little glands inside it, and there's a normal process where the surface of the cervix, there's a layer on the cervix that shifts back and forth. It's the layer that we're interested in capturing when we do a smear test. And that layer occasionally obstructs those little glands and causes a cystic type structure within the cervix, which we can see on ultrasound, or you can even see when you look at the cervix with a speculum. And those are typically about 1 centimetre across and sometimes get reported on an ultrasound, but they're an entirely normal finding.
Yeah, right. And what about the uterus? Can it get cysts?
Not really. There are unusual appearances to the uterus that we see in ultrasound. We pick up uterine fibroids all the time. Sometimes adenomyosis is reported as showing cystic changes, but that's not quite accurate. It's not a true cyst.
Okay, good. Now I'm bringing back an old favourite that we let go a long time ago.
Stop it. What?
Myth or fact?
Oh, fact. Okay, hang on a minute. Myth or fact?
You know, I don't think anyone likes that. But anyway, good. Number one question. coming off the pill causes ovarian cysts.
Myth.
Really?
Well, you'll get a follicular cyst, but that's the ovary working normally. So I'm saying myth.
Myth. And if people think that it is, it's probably because it was helping with something like PCOS or...
Well, yeah. Well, occasionally we'll use the pill in women who get recurrent large cysts because it suppresses ovulation. That's how it works as a contraceptive. And most of those cysts are ovulatory in origin. So it's a good treatment. But, and if you come off the pill, you might get that problem back again. But that's not to say that one necessarily caused the other. You just had that problem all along.
All along.
And you're taking away an effective treatment.
Number 2, a cyst can cause miscarriage in early pregnancy.
I don't think that's true either. Ruptured cysts can happen in pregnancy and they can be painful. But I certainly don't think it's an important cause of first trimester loss. It's a pretty unusual thing to happen in the first place.
Sorry, what is the...
having a ruptured cyst.
I am.
Yeah. I don't believe it's an important cause of first trimester pregnancy loss. You get pain, and occasionally that person might go and have an ultrasound and find out they'd miscarried, but whether one caused the other, I don't know.
A cyst can impact early implantation. Oh, he's stumped.
I don't think so. Yeah, I doubt that's a phenomenon. I mean, early implantation requires that the ovary's ovulated, the egg's gone down the tube, it's met up with some sperms coming up the other way and got fertilized, made its way down into the uterus. So I'm not sure that an ovarian cyst could necessarily interrupt that process.
Good. A cyst causes left-sided ovulation pain.
Just ovulating on the left side causes left-sided ovulation pain. It's neither here nor there when it comes to cysts.
And I think people can refer back to your answer about, what pain feels like if it's a torsion or if it's something, and the referred pain to the left side. So I think you've already answered that.
Okay.
Good. Forgotten what number I'm up to, but here we go. Here's another one. A cyst can burst and be painful.
Yes, so that's definitely a thing. And sometimes we make that diagnosis retrospectively. A woman comes in with a lot of pain. You do an ultrasound and there's a lot of free fluid within the pelvis, and you assume that fluid came out of a cyst. Now, you can no longer see the cyst because it's like a popped balloon. The cyst is gone. But if you see a lot of free fluid in a woman who's got a lot of pain, then a cyst rupture is sometimes the proposed mechanism for that pain and the diagnosis. Typically, that just goes away by itself, but it can be very painful.
And that's like the cyst problem resolving itself.
Yes, exactly. Yeah. And there can be pain for several days, to be quite severe.
All right. Can I just ask about that, though? So the person can manage that at home with pain relief, or do they need to see their doctor?
Typically, they would see their doctor because the pain would be very severe. They would have an ultrasound to rule out other things like an ovarian torsion, like a pregnancy complication, like an ectopic pregnancy. And then if all that was determined was that there was a cyst rupture, then the treatment is pain relief and rest until it resolves.
Good. Last one.
Yeah.
And I'm sneaking it in because it's not about pregnancy.
Sneak away.
A cyst means you are not ovulating properly.
That's not really true either. Those two events may be unrelated to each other. Like, for example, you could have a cyst on the ovary and still be ovulating just fine. So if we were investigating someone who wasn't ovulating, the presence of an ovarian cyst might be of some interest. But it doesn't necessarily follow that someone with a cyst would not be ovulating.
Good. All right. Well, that's the end of my myth or fact, which turned into true or false.
Good. True or false?
Yeah, good. All right. Anything else to add about
No,
cysts?
look, cysts in pregnancy, it's worth covering. It's something that happens from time to time. It's not at all common, but definitely a part of of pregnancy life and obstetric theory that people do well to be aware of.
And I think I wanted to bring it up because we do There is so much that we're learning in pregnancy, especially early pregnancy, and it's coming hard and fast, this big learning curve. And then you go into a doctor's clinic and they sort of talk about terms like cysts that you think, well, that sounds bad.
Yeah.
It must be bad.
Yeah.
So I hope we've demystified that part of your first pregnancy visit.
Yeah. So the vast majority of structures referred to as a cyst on a first trimester ultrasound are normal.
Great. Straight from the horse's mouth. Good. All right. Well, that's it for us. If you like our podcast, how you can help us spread our information to other people that I'm sure other people would be loving to hear the same sort of information that you are, is simply just sharing it with a friend, saving it on your Spotify or podcast by following it. And yeah, giving us a rating if you feel so inclined, hopefully 5 stars.
Nice.
That helps too. Good. All right, everyone. Have a great week. And until next week, see you later.
Thanks for listening.
Bye for now. Hey, even though Dr. Pat is, well, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.
Lee Campbell here, Executive Editor at Mamamia. I've been at Mamamia for 8 years, and in that time I've been sharing beauty tips, personal stories and shopping hacks right here for you. And the reason I get to do this is because we don't have anyone telling us what's appropriate and what we can't say or have to say about a product. I only answer to you, which means you get the unfiltered truth every time, no BS. So if I've ever helped save your skin with a beauty tip or shared a helpful shopping link or maybe just made a bad day feel a little bit lighter, I'd really love for you to join us as a subscriber. Subscribers get unlimited access to everything we make, every single article, every video and every single podcast episode, including our subs Mamamia Out Loud episodes. Plus, you're automatically entered into every single subscriber-only giveaway. You don't have to do a thing. And you get full access to Move, our at-home fitness app. But to be honest, the real why is that your support keeps this space alive for all of us. So click the link in the show notes to join.